Hello, it's Dr. Rhonda Johnson. Today is Tuesday, December 20th, 2022. Today I'm talking about COVID infection in U.S. kids. Now, all the information I'm sharing today comes from the CDC website. Now, here's some information for you that you may not know. The CDC estimates that 9 out of 10 U.S. kids between the ages of 6 months to 17 years has had COVID at least once. That's 90% of U.S. children between the ages of 6 months to 17 years, or more than 64.5 million children. Now let that sink in for a minute. Now, how do they make these estimates? Well, first, a little definition. The percentage of people with antibodies against a virus in their blood is known as seroprevalence. So the CDC partners with commercial labs across the country to do random samples of de-identified blood. That's, people who've had their blood drawn for various reasons, routine care, sick care, whatever. And they test for the presence of the SARS-CoV-2 nucleocapsid or N protein. That test identifies individuals who have had a recent or prior COVID-19 infection. I've talked about this before. Now, they did their survey in all 50 U.S. states, the District of Columbia, and Puerto Rico. Now, the CDC says their survey tests for detectable antibody. It doesn't necessarily show how many people have enough antibodies to protect them against reinfection, severe outcomes, or COVID-related complications. It's just whether or not that you've had an infection. So, 64.5 million infected kids means that there are a lot of kids who had infections that weren't detectable, at least by testing. According to the American Academy of Pediatric's website, as of December 15th, over 15.1 million children are reported to have tested positive for COVID since the onset of the pandemic. Now, there's a big gap between 15 million and 64.5 million. And again, the presence of antibodies in the blood means that the virus infection occurred. So the American Academy of Pediatrics notes that it will be important to identify and address the long-lasting impacts of the physical, mental, and social well-being of this generation of children and youth. Now, I've personally called these children the last, since the pandemic started, children of the pandemic. Experts don't even fully understand this virus. So we'll have a lot of children that we'll need to watch to see how they do. So that's my message today. As a pediatrician and as a parent and grandparent, it's so important to love our children, and we protect them to the best of our ability. We try to keep them well to the best of our ability, and it's not easy to try to keep your kids from getting infected with this virus. No parent should feel guilty if their child gets a COVID infection, just like you shouldn't feel guilty if you get one yourself. Because unless you're able to stay and live in a bubble for the last 3 years, you may have gotten COVID. That's my message today. As always, do your best to try to protect yourself, stay well, and I'll see you next time.